Dr. Susan Verghese, Medical Director of Smart Vision Hospital. There are more than 12.7 million people who are blind due to corneal blindness in the world. And in India itself, more than 3.7 who are blind due to corneal blindness. Now, people know about cataract and they know a little bit about glaucoma, but they ask what is corneal blindness. So there are many infections which can happen due to bacteria or fungi, protozoa, and there are infections due to viral which cause keratitis, and that is a corneal infection. So following these infections, sometimes due to an injury, some traumatic cause, then the patient's eye can become blind due to corneal opacity. So the cornea becomes totally opaque, which is usually supposed to be a transparent layer which allows the light to come into the eye and fall on the retina. But if the cornea, which is the anterior portion of the eye, is become opaque, then it becomes very difficult for the light to be transmitted, and the light diffracts in different directions and a clear image does not form on the retina. So what we do in corneal blindness is we do replacement, or we do a procedure called penetrating keratoplasty. So this penetrating keratoplasty is a surgery. Now we have a lot more advanced methods and techniques depending upon which layer of the cornea is affected. But for most people, they know that corneal transplant involves removing a clear cornea from a person who is deceased, that is recently passed away. Within 6 hours of that period, the cornea has to be removed. Usually it is the corneoscleral button which is removed from the dead person's eye, and it is replaced, put into an NK solution for a time period, and then the donor list, from the donor list we immediately call the patient and we immediately take the patient in for surgery. We dissect the cornea out because it is avascular. It is there is rejection free. There is no rejection usually, and it's a very successful transplant. Not like other organs where we need to be on steroids or other medication for a long period. But in a corneal transplant, because it is avascular structure, we're able to immediately replace the button. The exact size which has to be applied onto the eye is measured, and then the button is sewed on to the eye, and then we give some antibiotic and steroid drops, which is sufficient to enable it to heal. Usually we find very good success rate, and we encourage people to donate their eyes, because this gives both the eyes, once it is removed, it can be transplanted for 2 different people, and hence vision can be given to 2 different people. So we do extremely ask everybody to please donate eyes, because this is going to give life to so many people. Quality of life improves when you have given your eyes.